Hi guys, welcome back to Meds Made Easy. My name is Tarun Verma. Today we're going to talk about Nortriptyline, also known as Pamelor. That's its brand name. No one refers to it as Pamelor, it's just Nortriptyline. It's a TCA, a tricyclic antidepressant. What does that mean to you? It's just a really kind of old-fashioned antidepressant that's been around for a very long time. It has a lot of different purposes to it. So it's FDA approved for depression, but there are off-label uses such as for smoking, which it's not as effective. There are better drugs for smoking than that, but you can use it for that. Neuropathic pain, a few other things like that. So there are a couple of off-label uses, and that's kind of the reason why you don't see this as much in circulation anymore. A lot of older doctors like this, but the newer doctors don't really care to prescribe this one because they're newer, more targeted antidepressants on the market. It works by increasing serotonin and norepinephrine in your brain. It inhibits acetylcholine and does a bunch of little things like that that we don't want, which is why the side effect profile of TCAs is a lot bigger than the other antidepressants that are out on the market that are newer for that reason. Let's see here. You generally take it once a day. You do titrate up, and then you take it generally once a day, but don't hold me to that. Every doctor kind of has a different strategy for use. You generally, if you're just getting on this medication, it takes 4 to 8 weeks to see the full effect of this medication. And because it's an antidepressant, you do have to titrate off, meaning you have to taper off to prevent withdrawal symptoms. Let's see here, there's a black box warning for suicidality. This is just a black box warning that exists for all antidepressants out there. We don't know why it happens, but you can get increased suicidal thoughts on this medication, and I know that it's counteractive to what we want, right? If you're taking an antidepressant, you should be happier, not more suicidal or anything like that. But it just happens. We don't know why, but it's just something that we know to always caution patients for. So if you or one of your loved ones is on this medication, you notice that kind of behavior, you need to let the doctor know, because then they need to get switched. On the labels, it doesn't say that you need to change anything up if you're taking additional meds that go through your liver or your kidneys, but these medications are utilized through the liver and kidneys, so you do need to make sure that your doctor knows about everything that you're on to make sure that you're not overdoing it you're not overstressing your liver or your kidneys. We don't want either of those things. Pregnancy, you do want to display caution because there have been instances where it has caused issues with fetuses. But again, all antidepressants kind of have this warning that comes with it where it's like always defer to your doctor. Always have a conversation with your doctor to make sure that it's safe and right for you to take. For breast milk, it does cross through into breast milk, so you do have this thing called RID, relative infant dose. So if there's a certain percentage, it's a really small percentage, but as long as it stays under a certain percentage, it's safe for the baby to get breast milk with that much medicine in it. But anything over that, it needs to stop. So you have to make sure that you're getting your breast milk tested by the doctor and stuff like that, because if you're excreting too much medicine into your breast milk, then that's getting into your baby, and we don't want that. Here's a list of side effects. Again, the big thing is that this has a more wider range of a side effect profile just because it can do a lot of different things. So that kind of comes with more side effects. We want more targeted therapy because targeted therapy also minimizes how many like side effects you have. So I think that kind of covers Nortriptyline. Anything more is just kind of overdoing it. Guys, leave us some comments below if you have any questions about this medication. Subscribe to the YouTube channel, like the video, and let us know how we're doing it, or if there's videos that you want us to make, we will make those videos too. This is all just about helping you guys understand medicines better. Alright guys, we'll see you next time on Meds Made Easy. Bye-bye.